what we're going to do is, and just so everybody knows as well, we're just going to record this session. So this ultimately is for anyone who's just joined us, and I think there's a few more who have just come in. This is the senior pet session. So what do we class as a senior? Generally, any pet that's over the age of 7. Okay, now this might be a good time to check if you're in the right room. If you were looking for the junior pet session, that is not on tonight. That might be another. I'm just joking. There is no junior pet session. There's only a senior pet session. And I'm guessing everyone here is here because you've got a pet over the age of 7. Now, generally speaking, we use the number 7 as a rough term, okay, but it can vary, okay? So you've got a really large breed dog. 2 days ago, I had the pleasure of working with a beautiful Neo-Mastiff. A beautiful big dog. He's about 62 kilos, and he was 5 years old. Now, he's classed as a senior at that age, okay? These guys don't live a very long life like Great Danes, and so they become seniors at a much earlier age. But generally, by the age of 7, because we're working off the numbers of 7 human years, or 7 doggy years for every 1 of ours, generally, by the time your pet is 7, they will have reached the age of 50, okay? And I think, although we might not like to admit it, you know, by the time we hit 50, like, we might not refer to ourselves as seniors, but at the end of the day, let's face the facts. We're dealing with, you know, 50-year-old body parts, and, you know, we've had a bit of wear and tear over the years. We've had some life experience. We've taken some knocks, and all of that impact, depending on what kind of lifestyle we've had. If we've had a really cushy lifestyle, then the impact might not be so big. But if we've had a bit of a rough life and we've had to work hard, or we've been athletic in our youth, then all of those things start to create a bit of wear and tear on us. And so that's why we start to see these things happen in our pets as well. We start to see a lot of slowing down, and specifically, we start to see pain. Okay, so unfortunately, arthritic pain, and I'm not going to hold these guys back because I know they've got a lot of wonderful stuff to share, but ultimately, arthritic pain is a big thing that happens in our senior pets, and a lot of them will just suffer silently and not let on that they are in pain. And so I'm not going to talk all night. What I will be doing, guys, we're going to do this as it is a Zoom session. I thought it was quite ironic that we're talking about seniors on a Zoom session, because ultimately what we're really trying to do is get them zooming around again, right? We're trying to get them back up on their feet, feeling really good. And I was just going to see if I can share a photo with you. There we go. So I don't know if you can all see it, but this is a photo of my old senior cat, Megsy. Sadly, we lost Megsy last year at the ripe old age of 23. Now, it's a really interesting story with Megs. She came into our life as a 12-year-old. She came in over a long weekend. Somebody wanted to, they actually wanted to put her down because she was too smoochy, too smothery, and they were having a new baby. And this couple, they were lovely people, but they were just worried that she would smother their newborn child. And they figured at 12 years of age, who's going to adopt an old cat? And so they thought, look, it might be best to put her down. And so they brought her into the clinic, and one of the nurses rang me. It was just before the long weekend, and they said, Shivli, we've got this senior cat here. How do you feel about looking after it just over the long weekend, and then we'll organize something for her, you know, after the long weekend? And of course, you know, it was a very, very long weekend because Meg stayed with us, grew on us within those few days, and then stayed with us for several years after that. And so it was a really awesome experience, but I really learned a lot about pets, and particularly senior pets. When she came to us, she was an old cat who was on a cheap sort of diet. Her poos were terrible and stinky and sloppy. Her coat was ruffled. She was really stiff and sore. She really moved like an old cat, and we literally thought, hey, she might have another couple of years in her. Let's just give her a nice, happy couple of years. And, you know, we made some changes. Initially, we switched her on to really good quality food. We added in some supplements in her diet. You know, we started to monitor things. We took care of her teeth, all of those things. And then she just kept going and going and going. And one of the most surprising things when we first got her, because she could never jump, she was so stiff and sore, she would never jump or climb. And what we found was when we switched her onto the food, this new food, her poos changed and everything changed. But the most dramatic thing, one day we pulled into the driveway and we saw this cat sitting up on the fence. And we were like, whose cat is that? And we're like, hang on, that's Meg's. What's she doing up there on top of the fence? Because we've never seen this cat climb or jump. And literally within a few weeks, she was climbing and jumping and doing all these amazing things, which we never thought we would see her do. So that was a really cool thing to see. What I'm going to do, guys, is I will hand over. What we're going to do now is we're going to do this like a bit of a speed session. For anybody who is here, and I've split my screen into a few different compartments, so I can't see everyone. I think there's quite a few people on with us tonight. I think we're about 15 people or thereabouts. There is somebody who's waiting, so I'm just going to let them in. And ultimately, what we're going to do is we're going to do this like a bit of a Zoom session. It's a bit like a speed dating, speed interviewing session where we've got 3 pet health experts. And so what I'm going to do is we're going to unmute them, and I'm going to be asking some questions that we've received over the years. I've been a vet now for close to 17 years, and we get asked all sorts of questions about seniors and how to care for them and what we can do. And so what I thought we'd do is I've prepared a list of these frequently asked questions, and I thought we would bounce them around. And then if you don't hear your question being answered, I'm sure it will be, but if you don't hear your specific question being answered, then we'll open it up and we'll allow questions from the panel, if anybody does. Now, as a special gift for anybody who stays tonight till the end, and we won't make it a very long one, we're going to try and keep it to about an hour. For anybody who stays all the way till the end, we do have a special gift, and that is I'll tell you about the special gift at the end, but it's valued at $50, so you'll just have to wait, and I'll let that suspense hang there. It's valued at $50, and we'll give that to everyone who's here tonight. As well as that, there is also a special prize, which anybody who takes on the special gift, Tina has generously offered a prize, and again, we'll go into that, but there's something tasty at the end, I'll just say that. And as well, there's a bit of a needle session, which you can get some needling happening as well. So stick around. I'm just doing this because I know sometimes like everyone's probably all zoomed out and all webinared out, and it's hard sometimes to keep the focus. And as well, we thought let's not do it like a boring sort of death by PowerPoint style presentation and take you guys through slides, because yuck, who wants that at 7 o'clock at night? And so we thought we'd keep it real, just keep it between people. And look, if there is a time where I feel, look, images would really help to explain what's going on or what the gap that's needed, then we can always try and, tap into some slides and whatnot. But what I will do is I'm going to hand over to, I think we will start with, let's start with Moira. So Moira, this is just kind of a random thing, right? Because we didn't really work out what order we were going to go in. Moira, are you cool going first?
Absolutely, no problem at all. Hi, everybody.
Thanks so much, Moira. So guys, just a reminder for anybody who didn't hear us at the start, if you can please just mute out your microphone, please. And if I'm going to mute someone, Judy, I'm going to mute you if that's okay. I'm sorry. Don't take this personally, guys. I'm just muting some people. It's not that I don't want to hear from you. It's that we're just trying to reduce the feedback. Okay, so Moira, let's get into this. So ultimately, Moira, you work within the, how would you describe the industry that you work in? We don't want to drop any names and we don't want to like pitch any products here, but how would you describe what you do, Moira?
Yeah, look, I mean, I have always been very, very passionate about animal health in general. As you mentioned earlier, I've been in the industry for 17 years, so similar to yourself, Julie, but 12 of those years I spent as a veterinary nurse and also practice manager. And now I'm also heavily involved in dog agility. So I'm very passionate about joint health, so I'm excited to be here tonight. I guess now I do work for an animal health company that is really passionate also about animal health. And we do offer a whole lot of different areas of expertise, I guess, in things like behaviour, osteoarthritis, and numerous other things as well. So I currently, I guess my main role is educating vets and nurses on different products and where they can really fit in to be the most beneficial to pets.
Awesome. And you've got border collies, right?
Well, I actually have 6 dogs. Yes, I'm allowed to where I live. So 4 of them are actually rescue dogs, and 2 of them are very active border collies involved in agility. So one of my rescue dogs has had cruciate ligament rupture, so she's actually had surgery on one of her legs. She was never an agility dog, she's a rescue dog. The other had a broken forelimb as a 12-week-old puppy that I rescued as well. So, of course, osteoarthritis is close to my heart with these 2. And also being involved in the dog agility, I know how important it is for their bodies, because it is quite taxing on their bodies, jumping and running and all that sort of stuff. It's so important to maintain their joint health. So I've done a lot of work with body conditioning and getting the dog's fitness levels really great. So yes, I've got 6 dogs, and all of them are on some sort of, osteoarthritis preventative or treatment.
Awesome. Hey, I'm going to ask you a few questions, Moira. So you've got dogs who are obviously very active, involved in agility, etc. Now, although I mentioned earlier that generally by the age of 7, we start to see dogs slowing down, showing signs of arthritis, I'm just going to challenge that because, or maybe ask you to challenge that because when do you see dogs, like a lot of people say, well, my dog looks fine. I don't think they're in need of anything. They don't seem to be in pain. And by the way, guys, maybe just put something in the group chat. Who knows? I don't know if you want to turn your cameras on or who's comfortable with that, but you can put up your hand. It would be awesome if people turn on the cameras, actually. You don't have to turn on your mics, you turn on your camera, and that way we can tell that you're not like distracted or sitting on your phone or, we put you on the spot. We can also check out what pajamas you're wearing and, all sorts of cool things if you're comfortable. But look, if you're not, that's absolutely cool as well. What I was going to say is, put up your hand if you know what signs of pain are in a dog and what things you're looking out for, dog or a cat necessarily. We might have to do that when everyone's cameras come on. We'll ask that a bit later. But Moira, what we do is we see a lot of people asking the question, okay, I don't think my dog's in pain or my cat's in pain. Do I really need to start them on joint support? Why bother? Maybe let me wait till they're sore. What do you say to that?
Yeah, look, I think I'm also very passionate about behaviour. Got a few areas of passion, but one of the main things I find is that with pets, they have evolved over time, but they still are very cautious, I guess, in showing pain. So a lot of the time when they are in pain, it can be quite progressed before you actually see that they are showing actual signs of pain. So they may not exhibit signs that they have arthritis, or they might be very subtle signs that we don't pick up on, but our senior pets will often disguise it or try and hide it so they don't look like a weak member of the family and things like that. It's almost like it's a protective response that they do to try and not show pain. And also in saying that, some of these disease processes that we see that will lead to pain can be very slow in their progression. And often, these early stages of things like arthritis, you won't necessarily see those external signs until the disease starts to progress. And that's why it's so important, particularly for certain breeds and levels of activity that the dogs are doing and that sort of thing. It's so important to try and prevent these signs from getting worse quicker. So we can try and slow down the progression of things like osteoarthritis by using certain products and supplements and things like that. So yeah, even if they don't outwardly display pain, it doesn't necessarily mean that they're not having something going on in their joints and things. And that's why it's so important to have those regular checkups with the vet, so that the vets can determine whether there is perhaps some limited movement or flexion, or even, recommending radiographs and things like that. But some disease processes, such as even hip dysplasia, on an X-ray, for example, there might be significant changes in the joint, but the body might compensate with muscles and other things, the body compensates for those conditions, and they might not outwardly show that they have a condition as serious as hip dysplasia.
Absolutely. And so just to go through, and it's probably tricky with everyone in different places and cameras off and whatnot, but look, the general signs that you would see of pain, as you've mentioned, like people generally will pick up on, my animal is stiff, or now when the cold has come in, they start to seem to be struggling to rise. When they're lying down, they're struggling to get up on their back legs, or they used to just run up and down the stairs. Now they get to the bottom of the staircase and they kind of look at the stairs like they need to work up the courage to go up or down the stairs. Other things with cats specifically, instead of just doing things in one big leap, they might go in little steps. So you don't see them, like I told the story of Meg's jumping up on the fence, on the top of the fence, like you might see them taking little steps. They step on the chair, then they step on the table, and then they move to the counter to eat your food, things like that. Those are the sorts of signs that generally people see. There's other more subtle signs as well, such as like panting is quite advanced as well, but panting can be one of the other conditions. It can be numerous other conditions besides just joint pain. But let me ask you this, Moira. What about the people? So a lot of people have said, well, my dog was suffering from stiffness, etc., and I started some supplements. So supplements specifically, we're talking, guys, and I'm not going to name any specific products, but we're talking about things like glucosamine, chondroitin, omega-3. We're talking about, you can get these injections with something called pentazan in them, pentazan polyphosphate, and those things, polyphosphate, am I getting my words wrong? Polysulfate, thank you. Thanks for the correction. Which all stimulate the joints, and we'll probably ask Moira in a minute as to how these things work. But what do you say, and maybe this would help answer that question, is sometimes people start their animals on this and they feel, I'm not seeing any results, so they've stopped it. What do you see that? Like that must be a common thing. People start it and they go, I thought this would help, but I didn't really see any results. So a few months in, I decided not to continue.
Yes, well, I guess, you can't see inside the joint. You can't see the cartilage breaking down internally. And as I mentioned earlier, the disease process, it can be it's quite progressive. It can progress quite slowly. The benefits of using supplements and things like you mentioned, the injectables, is that it will slow down that process. And it works internally. So doing things like, increasing the fluid in the joints. And you mentioned things like glucosamine and chondroitin, and it's, it's going to provide those building blocks for the cartilage and really, prevent enzymes that are destructive getting into those joints that will cause further breakdown of that cartilage. So sometimes, I guess it's the same with people too. Often, you don't realize how well it's working until you stop using it. And sometimes, you don't see those results immediately, or you're using it at a time where the disease is progressing faster, but you might not be, so that how to explain it? Sorry, but so if you're giving the injections and things at a time where the disease is progressing more rapidly, you might not see the improvement as dramatically as you would hope, because the disease may still be progressing as well, if that makes sense. But generally it will be doing the internal work that it's meant to be doing by pushing the joint and providing that, slowing down that process of the cartilage breakdown.
Absolutely. And so I suppose what people see acutely are the signs of pain, right? They're seeing stiff dog one day or stiff cat and then not stiff the next day. But with these joint supplements, they often don't see that immediate sort of switch on, switch off. Is that right? Would that be fair?
Yeah, absolutely. And it's the same in humans when you're using supplements and things. It may take 4 to 6 weeks to really see an improvement. There is some good research on some of the supplements, and one in particular it was 70 days before you saw that really good pain response. So it is taking time to see the response, and a lot of people do stop it too soon because they're not seeing that immediate response. So it is something that, you know, will help provide the cells and things that are needed for the joints. So it can potentially take time.
So a lot of people ask us, can you just use a human product? I mean, you can get these things, you can get fish oil capsules for like cheap as chips, you know, wherever, from discount, you know, chemists or whatever they're called. You know, you buy 1,000 little capsules, and this generally is not as much dearer than buying a dog supplement or, you know, a cat supplement specifically. What's the difference?
Well, first of all, I personally wouldn't use anything that the vet didn't recommend for my own pets. So I think it's, you know, I'd like to provide them with the best care. But, you know, a lot of human medications too, obviously they're not dosed correctly for animals. So it's sometimes impossible to get the correct dosing. People can overdose their animals. Some people think it's fine to give things like Panadol or ibuprofen for animals, and that can be deadly to animals. Also, obviously, a lot of the animal products go through a strict regulation process. So they are proven to be safe on animals. They're proven to not contain any harmful ingredients that may cause harm to the animals at all internally. Some human medications may contain things such as, you know, xylitol or some other products that may potentially cause harm to the animals, and you don't even know. You know, there is no regulation for a lot of the human supplements. Basically, they can say a lot of whatever they like on the packet, to be honest, and you don't know exactly what's in it all the time. So it's really important that you are speaking with your vet and getting the correct recommendation, and making sure, you know, that supplement's right for your pet. You're giving it in the correct doses, and it is an animal product that has been safely tested on animals and contains no harmful products to them as well.
Yeah, brilliant. Thank you. And there's within that, okay, so within the pet product range, there's different prices as well, right? Like you can go to Woolies and get stuff like, we see this with parasite control, for example. You can get like cheap things online or whatever, and then you get other ones, and sometimes the ones that are sitting on the shelves at the vets are more costly, and these are, now we're not comparing with human products, we're just talking purely animal products, but within that there's different brands, different prices. What's the difference there? Why would you bother spending money on Deira products?
Well, I guess there's a lot of different reasons, but you might like to elaborate as well. But I guess you know, some of the more expensive products are containing the ingredients or more ingredients and that sort of thing as well. They're veterinary registered or also recommended, you know, for animals and tested and gone through that rigorous safety. Some products that you get online, you know, you can get imported products that may not be registered in Australia or not contain what they say. So, you know, if you're going to the vet and you're getting the recommendation and you're ensuring that you're getting the product that they're recommending, and that it is, you know, the one that is made for your animal, that will be the best one for your pet.
Yeah, look, I think going back to what you said, I might just add to that, you know, there is this idea of bioavailability, and what that means is, okay, maybe on the side of the package it says it's the same ingredient, okay, this bottle looks the same as that bottle, but the way that it's compounded, the way that it's processed, the type of capsule that it's covered in or coated in, where that medication or supplement dissolves in the body and at what rate, all of those things will affect how much benefit the animal can get from that product. Would that be fair?
Oh yeah, absolutely, yes. I kind of missed that one, but yeah, absolutely. So, you know, some need a certain coating to be absorbed correctly by the animal. There's all sorts of reasons for it as well.
Cool. Okay. So a couple more questions that I've got specifically, and that was, okay, why use an injectable? Because I know there's injectables and then there's oral supplements, right? And I mean, we have a lot of patients, like so many of our senior patients are on the injectable, and I mean, you can just see how much better they are, and their mums and dads bring them back religiously for that on a regular basis. And usually they start to see them, you know, towards the end of the month, they're starting to need a little pick me up. And then as soon as they get that, they're back on their feet again. But you've got the injectables, but then you've also got the oral ones. Now, could you explain why would you need one or the other or both? Why? I mean, we recommend both, but could you say why?
Yeah, look, you mentioned the word bioavailability, and that is the absolute reason why we give the injectable. So basically it means that the body absorbs it quicker and more effectively. You're giving the product at the highest dosing so that you're providing the body with the cells and things that it needs, the molecules that it needs to help, particularly in this injectable, to regenerate cartilage and provide that joint support. So these injections are generally given in that initial course of 4. It's almost like a loading dose to an effect. You all would have heard of that. So giving that course of 4 every 4 weeks and a week apart for the course of 4, you definitely see the benefits in the months following. So using those 4 injections with that high bioavailability, you're providing the joint with all those things it needs straight away. And as I mentioned earlier, some of the supplements you see may take longer to really help the joint internally. So you may not get the amazing result in that pain response sort of until 4 or 6 weeks down the track. So giving the injections as that initial course, you get that immediate sort of response, and doing those 4 injections over the course of the 4 injections, it's shown in all the studies that it will provide benefit for months following. Using the supplements alongside, so they work slightly differently, but it's all about, you know, slowing down that process of cartilage, you know, degeneration. So you would still use the supplements alongside your injections. Sometimes after using your supplements for that 4 or 6 or 8 week period, you start getting those benefits additionally, and you sometimes may be able to last longer between your injections as well, to provide that additional support. But yeah, definitely the injections are, the medication itself is there at the time you give the injection at the maximum dose, and you're getting the most benefits from that. But supporting it with your supplements is also really beneficial.
Okay, and so look, there's probably the last question, I guess, is we spoke before about certain breeds and dogs, and it could be any breed. You might live a really active lifestyle with your dog. Like I know for yourself, they do agility, etc. And so while I've mentioned the sort of the magic age of 7, is that something that, you know, when would you consider starting earlier? When do you wait until they're 7 years old, or do you wait until they're stiff and sore and creaky and aching, or would you start earlier?
Look, I absolutely start my agility dogs younger. I'll even start them as young as 2 or 3 years of age if they're going to be a highly competitive dog. So I am very passionate about prevention. So, you know, being able to prevent these disease processes in the first place is super important. So there was a study done. I took a few notes that I read on a study just recently, and it was from 2018. And they looked at the breeds that were most likely to develop osteoarthritis. And some of those breeds listed, there was 11 breeds that stood out in the study, and Border Collies were on there, German Shepherds, Golden Retrievers, your Labradors, Rottweilers, Springer Spaniels, Bull Mastiffs, German Shorthair Pointers, Dogue de Bordeaux, and a Scottish Collie, which I'm actually not very familiar with Scottish Collies, but that was the 11 breeds that really stood out in that study, which I found interesting. But yeah, absolutely, these sort of breeds and I'm sure that Dr. Shibley and Dr. Winnie will also say that weight, so dogs that are heavy or overweight, and Tina also, when you talk about nutrition, you know, the weight of the dog, obesity can be also a leading cause as well. But yeah, these breeds, their weight ranges, how active they are, your vet will definitely be able to determine when they should be starting as a prevention. Absolutely.
Yeah, okay. Awesome. That's great. So guys, what we might do is we might just hang on to questions. If anyone has questions, I think the easiest way might be to just enter them into the chat box as we go. And we are going to be covering a few more topics. And so what we'll do is we'll collect those questions. And if anything's not answered, then we can answer them towards the end. So if anyone has questions, please just use the chat box that you've got down the bottom and enter that. Thank you so much, Maura. That's been amazing. Really appreciate that. So let's bring on Tina. Tina Brown, can you unmute yourself, or do you want me to do that for you? Okay, wonderful. Thank you. Thank you. Thank you. So Tina, are you, how's the little kitten coming on? Are you still suckling the kitten, or have you managed to get somebody else to help with that?
No. I'm still plugging away. The kitten spent Friday in intensive care.
Oh, wow.
Decided to try and die on Thursday night.
No.
So we had a fairly harrowing day on Friday, but it's back to terrorizing my house and screaming every 4 hours for a bottle. It's 3 weeks now. So we need to start stretching those feeds because one of us needs more sleep.
You're both going insane. Well, I guess with everyone working from home, although now the restrictions are all being lifted, but so when you're working from home, like night turns into day, and then it doesn't really matter anymore, right? Like waiting for 2 hourly feeds, like.
That's why when I got asked to do it, I was like, I'm sitting at home. It's fine.
Yep, bring it on.
Yeah, absolutely.
Oh, that's awesome. So Tina, tell us a little bit about a story of yours. Did you, because you grew up, you had a really old doggy when you were growing up. I know you were sharing a story with me. Can you tell us about your background with senior pets and why are you passionate about them?
So, and it's a really good hindsight story, actually. So when I was about 12 months old, my dad decided every girl needs a dog. And I got a Cocker Spaniel. And his name was Max, named after Maxwell House Coffee. And Max was my sidekick until I turned 18. Actually, it was 19 because he was 18 years old. And Max, by the time we lost him, he was deaf and he was blind. But we lived on acreage and he had a little track that every morning when we let him out to go to the toilet, he'd run that track and he didn't miss a beat and he didn't bump into anything. And it was amazing. And doing what I do now for a living and knowing and bumping into people like Moira who have all of this great advice around what's available. And we're talking some years ago now. The ability for us now to do so much more for our aging pets because we're better educated. The industry's come such a long way, so we can do things for these animals that haven't been able to be done in the past to make them comfortable in their senior years. And I really love that we're able to do that.
Absolutely. Yeah. And look, I know you've helped so many of us with our senior pets, and you're always very generous with lending support and help. And so that's why I thought you're the perfect person to come on and talk to us. So let me ask you this. Well, aging pets, a lot of people feel, well, I don't think that food can really help my pet. Like I'm thinking I either need to do something drastic, like put them on hardcore medication, drugs, or like they're getting old. We just have to they just have to deal with it. That's just their life. And then when the time comes, we'll, unfortunately have to say goodbye to them. It's kind of like a black or white, we don't sort of see all the shades of gray that are sort of in between. What would you say to someone like, if I wasn't convinced that food could really help my senior pet, what would you say? What have you seen?
It's really interesting because we strike this a little bit. And the really lovely thing when you come off the other side of this is to speak to that pet owner that had completely underestimated the ability, the effect that good nutrition can have on their animal. You know, and I suppose we often liken it to, when we're talking to people, it would be like feeding your child McDonald's every meal, every day of their life. What's their health going to be like? Opposed to feeding them really good, well-rounded nutrition with lots of veggies and stuff that's really great for them. So that's our like a big message behind feeding a super premium diet and feeding good quality food. If you can feed it in the early years, research has shown us that you're able to head off some of these disease states that aging pets tend to get. And it very much is a life stage thing. So if you've got a new puppy, you need a specific diet for puppy, and we all know that. And everybody's well aware that if they get a puppy, they need a special puppy diet. But a lot of people are not aware, like you said, that once an animal kind of hits that 7 years of age, although there's nothing visual on the outside, internally we know these changes have started happening. And the need for us to support them at that point is really, really important. So we do things like, we use nutraceuticals in the diets, which are things like you spoke about before, omegas, all the stuff Moira was speaking about. Kind of our industries go hand in, or the different portions of the industry all go hand in hand, and we're all trying to achieve that same goal. One of the big things, or probably the most important thing, like Moira said, that we do aim for in aging pets is to make sure that they're not fat. Carrying excess weight causes all sorts of issues, joints, heart, lungs. There's issues, many issues with a fat pet. So
and
making sure that our aging
kids,
pets,
right? Like my kids were picking on me earlier. So that's what happens as you get old, right?
but absolutely. But we do things like, as I said, weight is a big thing for us to target in aging pets. The other thing that we can do is we can provide things like joint support in their food. You've got to feed them anyway. Why wouldn't you have something supplemented into their food to deal with that? We use things for cognitive function as well in diets for aging pets, at which we know that if the aging cognitive issues are just around the corner for them. So if we can start using these nutraceuticals to support them with that. We put a lot of thought into our senior diets. Our senior cat diet, for argument's sake, we make the kibble soft because cats are living so much longer. It's not unusual for us to hear about a 20-year-old cat these days. And at 20, chances are they've lost teeth or they've got dental pain. So we then make that kibble softer. So there are lots and lots of advantages to feeding your animal a super premium diet, especially moving into that aging stage.
Yeah, that's awesome. And so we've used the word cognitive there. So just to put things in plain terms, it's senile behavior, basically, that everyone starts to show as we get older and we start to develop dementia. And we become senile, and if we were dogs or cats, we'd be barking at things that weren't there, or barking at the wall, or not recognizing people who we should recognize. Mum and dad come down, and suddenly we bark at them like they're some stranger. These are the things, or meowing at 2 a.m, just relentlessly for no reason. We don't need the toilet, we don't need to eat, we don't need anything. We've just decided we're going to start meowing at 2 a.m. So these are the sorts of old age changes that we see. And the cool thing is that diets can help with that, which is really awesome, because there's not many things which can help with senility. And, we don't have old age homes for cats and dogs, and we become their full-time carers. And so, we need to learn how to deal with that. And anything like this could be really helpful. What about, here's a big one we get, fussy pets, right? They're like, yeah, that's fine. I know I'm supposed to feed my dog that. I know my cat's supposed to eat that stuff, but they won't eat it. They're fussy. How do you get around that?
We're very much a try and see the food that we manufacture, and largely super premium food is highly palatable. There's no point us putting years and years of science and money in research to formulate a diet if an animal's not going to eat it. So it's in our best interest to make sure we provide a diet for you that is highly palatable. We offer 100% money back guarantees in the industry. If you ask, when you're looking at purchasing your super premium pet food, ask if your pet won't eat it, whether you can have your money back. Your super premium brands will generally offer that refund. I've been doing this role, as we said, 8 years, and I would say my return rate off under that offer is probably about 2%.
Oh.
There's little things that we can do that when you first get them home, and it's a change of food, sprinkling some warm water across it to make it smell better and stimulate their senses. But largely, we don't seem to have a lot of issue with an animal taking the food on.
Good. Excellent.
Sometimes it can be tough love, though, because we do tend to pander to them just a little bit too much sometimes. And it's not about putting that one bowl down and go, oh, he doesn't like it. It's about telling him on day 2, mate, this is your food now. It's good for you and you need to eat it. It's like coming back to our McDonald's analogy again, put a piece of broccoli in front of your child or a hamburger. We all know which one the child's going to choose.
Absolutely. And so here's something, and this kind of ties in a little bit, Julia. We got your question there just about a greyhound with worn down teeth. And that might be something I might ask Dr. Winnie to talk about just with regards to the dental side of things. But don't they need a wet food?
They don't need a wet food. So a wet food is nice to have. So we know that 70% of Australian pets are fed wet and dry food. Our dry food is complete and balanced, so there's no need to feed anything else, but it is something that pet owners like to do. With aging pets, and Winnie will again speak about dental, but we need to be a little bit careful in that introducing too much wet food can sometimes lead to dental disease. So that is a watch out around that space for an older pet. And it's a bit of a double-edged sword, because there's clinical conditions that sometimes these aging pets are going to get, and a vet would like to see increased moisture content in their diet. So then we would offer a wet food with their dry food to that particular animal. So it's not you don't need to, but it's nice to.
Okay. I mean, look, just from a dental disease angle, I'm sure we weren't really going to talk about dental disease too much tonight, but it kind of comes in because it is like the most common disease that we see. Like 85% of dogs over the age of 3 have dental disease. So it's hard to not to come up at some point in any animal conversation. But I think ultimately, we certainly see a lot more dental disease in the dogs and cats that are fed solely wet food diets than the ones who are on kibble. And that's not to say that all kibble diets are equal either. The diets that have, there's ones that just crumble, when they jump into it, they will just crumble away and the teeth don't get any workout or clean up. And there's other diets which they really have to sink their teeth into, and they get a lot of traction there, and therefore it physically brushes the teeth. So look, we're not talking specifically about dental disease tonight, but that is something that, it is a source of pain, and seniors tend to have more dental disease than others. They may be not as voracious in the way that they chomp their food as well, and therefore, they might not do as good a job cleaning their teeth. Tell us about a couple of things that people ask about, Tina, which I'm just going to ask you, because there's been a lot of talk in the human industry, and guys, it looks like we might be, we're going to try and roll through these quickly, but I mean, this is kind of interesting, so we might roll over time a little bit. But if anyone has an issue with that or they need to tap out, that's okay. But just let me know, hit me a text message and I can connect with you later. Variety, right? We're worried about variety. Like, isn't it boring that they should have to eat the same food every day for their whole life? Tina, why do we do this to our pets?
That's a really, really interesting question. And probably to start your answer, to put that in perspective, is when we look at humans' taste, humans have 9,000 taste buds. A dog has 1,700 and a cat has 500. So when we're looking for variety because we think that they want a different flavour, the flavour's probably quite moot to them anyway. At the point you've only got 500 taste buds, you're not getting the flavour, the full flavour experience like if you ate the food, I'm guessing. We know that they're creatures of habit, and they do look for that habit and they do look for that consistency, and it gives it to them. The other thing it does is you can be as lazy as you want when you get home from work. Scoop out that cup of food and put it out. So yeah, no, they're not looking for the variety. Again, it's a human thing that we put onto our pets just because we love them.
So let's talk about that, because raw food has gained a bit of interest as well. And I don't know, I mean, I struggle to eat a complete balanced diet, but tell us about raw food.
Yeah, raw food's a really interesting one for us. So it is extremely hard, if not impossible, to formulate a complete and balanced diet if you're feeding raw without engaging. And there is a dietitian in the country, a doggy dietitian, I guess you could call that, in the country now, and you can pay her $200 and she will formulate a complete and balanced raw diet. But the ingredients are expensive, it's time consuming, but it is available, and that's the only way you can do it correctly. It is really, really hard to get it complete and balanced if you're trying to do it at home and pop everything together in your kitchen. The really interesting thing that I like to talk with people about is the ability for bacteria to get into that raw food. We know that a dog can have full-blown salmonella poisoning and not show any clinical signs. So you could have a dog walking around in your backyard that has salmonella and you don't even know it. The scarier part of that is that the salmonella bacteria stays in their feces for up to 10 days. So if you've got a small child running around in your backyard, you're actually putting your family at risk. And that's a real concern for me. And a lot of people don't realise.
That's pretty scary.
There's, and there's, when you look at the research, there's no published evidence around advocating raw feeding. There is, however, a lot of stuff published around the hazards and the fact that it is the difficulty in making it complete and balanced.
I think sometimes we look at them and we go, yeah, but the animals are from the wild, they would eat raw stuff. So what? So what if they eat raw?
Yeah, and I would say, do you know what I would say is, we live in Queensland, and if you want to go and get a hunk of meat out of your fridge and throw it into a bowl on your back deck, and would you eat it 2 hours on? I'm sure I wouldn't.
And I think that's the key, is that we've domesticated our pets. We've
and we're not dealing with wild animals anymore.
We're not dealing with wild animals. Like, certainly, the little fluff balls that go to the groomer every 6 weeks and have, dyed ponytails and, ribbons and stuff, like, they are not wild animals who could certainly cope with that sort of raw diet. And the life expectancy, in the wild, animals would live to 3 or 4 years of age, and one infection, one tooth root abscess, one wound from a fight, one rotten carcass with a salmonella overload poisoning, and that might be it, and that's your days. And then you'll get picked on by the rest of the gang, kicked out of the the group, and you might die. So it's a really weird, shocking way to try to rationalize, going back to the way things were and being, paleo almost, to the point where we go, let's not worm them. They don't need heartworm and this and that and, foods and whatever. Like, let's just treat them like wild animals. Okay, so let's move on. Yeah.
Interestingly, we first started domesticating dogs 18,000 years ago.
Wow.
That I was really, when I heard a vet speak around it, and when I heard that's a long time.
It is, and 18,000 years of meddling, and our dogs today look nothing like the dogs that once were. And look, I'm not going to get into all the breed stuff, because that's a whole nother can of worms right there. But just tell us again, another one of those human things that's kind of crept into the animal industry is grain-free. Everyone wants a grain-free diet. Tell us about that.
So really, really interesting statistic. 95% of allergies in animals are from a protein source, not a carbohydrate. It is very, very rare for an animal to actually have a grain allergy. So as you said, it is a human thing that we're pulling across from, gluten-free and all this sort of stuff that people are doing in their own diets. And we are seeing largely, if you look at the trends in human dietary choices and you look at the trends in animal dietary choices, they don't really choose, but what people are choosing to feed their animals, it mirrors one another. So people are taking all of this stuff that they're learning about their own health and feeding their animals that way, when in fact it isn't necessary. If somebody's listening tonight that has moved to a grain-free diet and has actually seen positive or improvement in the animal, so the reason that they've moved it, and is now like, oh, the dog's actually, the skin's looking better, it's not itching as much. What I would say to you is that the reason that you're seeing this improvement is when you move to grain-free type diets, they're usually using quite a novel type protein. So they might be using a fish or some lamb. When we know in this country, your top 2 allergies are chicken and beef, because that's what they're mostly fed. And you have to be fed something to develop an allergy. So when they're moving across to these grain-free style diets, they're switching protein as well, which is the cause of your allergy. That's why they're seeing that improvement. The level of food in the marketplace that's doing and campaigning this sort of stuff, there's not a lot of research and development behind them. So if you flip one of these bags over, often it will say the protein source is pork, lamb, or turkey. And it will say OR. So what they've used is what they can get their hands on at the particular point in production, which may be for cost reasons, availability, who knows. But you can continue feeding that grain-free diet, and then at the point they change the protein, bam, your animal's back where they started from. If you're using a super premium brand, if they're making it with lamb in 2010, they're making it with lamb in 2025. We don't mess with that stuff. If that's an ingredient, that's the ingredient. So it is a protein. Protein is your allergy, not your grains. The other thing is, and I'm sure Shibli, you have probably seen some of this stuff. In the US, they've been feeding grain-free diets now for 10 to 12 years. And they're starting to see some cardiac disease surface. And the Food Administration has actually investigated it, and it is pointing at grain-free diets. We're young here in feeding grain-free diets. We're a couple of years in. So it begs the question, let's hope we don't end up where they are, and let's hope we learn from the mistakes that have been made over there and the things that they're finding out.
Yeah, well, let's let them make the mistakes first so we don't have to. So, yeah, look, it's scary. It is scary. And this is the thing, like it's so unregulated. Like these days, anyone can come out with a new treat or a new toy or a new diet or a new whatever, toothbrush or something. And, it becomes a fad. Like somebody messaged me the other night and were like, what do you think about these beds? Like there was a Facebook ad for a bed, an anti-anxiety bed. And people were like gobbling this up. And someone messaged me like, what do you think about this bed? And I was like, well, there's no proof behind a bed. It just looked like a normal bed to me, but they labeled it an anti-anxiety bed. And, it kind of it was fluffy. You could put it in the washing machine, of course you could do those things. But I guess, guys, like, I think the reason why I wanted to coordinate this night as well is that there is so much misinformation out there. And unfortunately, when you're a pet lover and a pet parent, and you just want to do anything for your pet, and you see them with anxiety, or you see them with pain, or you see them struggling to eat, or whatever it is, and someone offers you something on Facebook, you're like, oh, that sounds like the thing. And there's certain words that they use, or with food, it's like shiny packaging or celebrity endorsement, or, like expensive. Like sometimes you go, well, it's expensive. That's another one, Tina. Like they're like, well, I'm feeding the expensive stuff. Surely if it's expensive, it's good. Is that true?
No, expensive doesn't equal good, not even close. And like you said, the packaging, often you'll find in these non-super premium brands, they've had a marketing person do some research and they put all the right words on there so that you as a consumer go, oh, I've actually heard, oh, my cat needs taurine. Oh, it's got taurine written all over the bag. So that's a bit of a watch out. But what I would say is a good quality food is a business that puts money into research and development, and is a company that if they're claiming that it can assist in your dog's joints, that if you ask to see some evidence-based research, it can be provided. it's someone that's prepared to stand behind what they're selling is a good diet, not because you're paying a lot of money for it.
Absolutely. And I think that's what it comes down to is some of these companies, you just don't know what their backing is and where they've come from. And they haven't been around long enough to see those long-term diseases that you've mentioned will start to surface after years and years of feeding. Like, it's not a quick fix. You're not going to see the change in the next week or day. But at the same time, you might not see disease surfacing for several years either. And that's the scary thing about it. So I think that's probably all the questions I have around nutrition. Guys, if anybody else has questions, feel free to throw them into the chat box. What I might do, just in the interest of time, is I'm going to jump over to Dr. Winnie. Thank you so much, Tina. That's been amazing. Guys, if you got some benefit from that, just hit in your chat box and just say something, something to Moira, something to Tina. If what they've said there has answered some of your questions or you got some benefit from that, just let us know. Let's make it a little interactive. There's a chat box down the bottom. Just type something else in. You know, you can say hello. You can say whatever you want, but just let us know that you're there and you're getting some benefit out of this. And what I'm going to do while you're doing that is just introduce Dr. Winnie. So Winnie, I've asked you to come on tonight to just share with us a little bit about acupuncture. And I know for a fact you've got your own senior pet going in for a pretty heavy surgery this Friday, I believe, having like a joint fusion. Is this too close to home? Are you comfortable sharing, Winnie?
Yes. So Kobe, he's my senior Japanese Spitz. He's going in for a carpal. Yeah, it's a full fuse of his wrist. I think like Moira's dog, he was a rescue dog, and I got him when he was 4. But I guess the history was that he broke his forelimb when he was 6 months old, something like that. So previous owners didn't tell me, but I did notice a bit of a limp when he was much younger. So we x-rayed the leg and I realized it was an old fracture. So obviously over the course of the years, he's developed a lot of arthritis in that leg, and it's just gotten really bad now. So no matter what I do, you know, throwing all sorts of stuff at, you know, everything that you do for senior pets, it hasn't really helped. So this is going to be the only thing that's going to take away the pain, pretty much, is fusing the wrist. And hopefully he'll be able to, you know, walk on it without any pain. So that would be the aim. So he's going to be a changed dog after this Friday.
Mm-hmm. That'll be awesome. And I know, so Winnie, a few years ago, you started practicing acupuncture. You, you know, went down that pathway. Do you mind if I just dig around there a little bit? Like, what was your journey into acupuncture? Like, why did you start offering that? You've been a vet for several years as well. How many years is it now, Winnie?
2002.
Okay.
I graduated, so close to 18. But
yeah.
I think it was 7 years ago I started getting interested. But I guess the backstory is that my dad, he's a sign writer, and because he uses his hands quite a lot, and he started developing rheumatoid arthritis pretty bad in his fingers, in the joints, so they're all swollen and sore. So he used to go for acupuncture on a weekly basis, and he's still practicing. I mean, he's still working today, and he's in his 70s. So he obviously, you know, it helped him a lot, you know, regain movement or mobility in his fingers, and he's still able to work. So I saw it firsthand, and for him it worked. It took away some of that pain as well. So I guess being Asian, I got interested in the Eastern medicine, the more holistic medicine. So, and there's a lot of research, you know, that shows that, you know, as an adjunct therapy, it really does help with the traditional, you know, medicine.
Absolutely. So can you explain how it works?
Okay, so basically you're inserting really fine needles into meridian. So there are specific areas where nerve bundles and blood vessels intersect, pretty much. So when you insert needles into these, well, they call them energy channels, it promotes a response. So basically, it increases the production of the body's natural painkillers like endorphins, and it regulates the immune system, decreases some inflammation as well. So that helps with the pain and just, it enables the body's natural ability to heal.
Yeah, so that when I was looking into it, so that they explained it like that ultimately the body has natural healing pathways and energy channels, and then those blocks, essentially when there's an illness or a pain, there's a block in the natural energy healing channels, and the acupuncture essentially releases that block or activates it. Would that be fair?
Yeah, something like that.
Okay.
But it's just really interesting how, the Chinese discovered that and discovered, the specific points. Like, who would think about, just sticking needles in and seeing where it helps? I don't know. I really don't know. Blows my mind.
Well, the cool thing, and I guess, being a vet, going to traditional vet school and learning the sciences, we're always a bit skeptical about holistic and alternative therapies. But at the end of the day, you've seen results in your dad. I saw results in my own mum. And, we started to I know Meg's had a few acupuncture sessions as well over the years. And so how long is it, Winnie, before you start to see, well, let me ask you this first, like, who are the ideal candidates? Like, there's so many options. We've spoken about diet, we've spoken about joint supplements, orals, injectables, but also, there's obviously medication, and we haven't spoken about anti-inflammatory medication at all. And part of the reason we haven't spoken about it is because, while it's a really good way to help relieve pain and swelling in joints, it's not without risks, it's not without side effects. And animals that do go onto this medication, before they start anti-inflammatories, and while they're on anti-inflammatory medication, they do need to have a regular blood test done every 6 to 12 months. They should have a checkup, a blood test, etc. Make sure the kidneys and liver, etc. are fine. Which are the patients that you see most benefiting from acupuncture, Winnie?
So obviously senior pets are, prime candidates, just because, as they get older, they start getting degeneration in some of their organs. So as you said, I mean, there's a lot of non-steroidals that can cause further damage to the liver and the kidneys. And a lot of these drugs are metabolized by the liver or excreted by the kidneys. So a lot of the senior pets can't take, full doses of the medications. So that's when acupuncture can help quite a bit to alleviate some of the pain if they can't take, more traditional non-steroidal medications. So obviously not just seniors, but it does benefit from any other like metabolic disease or dogs that are recovering from orthopedic surgery, muscular and other musculoskeletal problems like hip dysplasia or acute issues like sprains or strains. But not only that, allergic dermatitis, respiratory issues, hot spots, wounds. So quite a few conditions that can benefit from acupuncture.
So, how long is it before you generally see a response, a positive response in your acupuncture patients?
If it's
arthritis and sorry, that's a bit of a broad question. Specifically for arthritis and pain.
Okay, so generally, the general protocol is they come in for weekly sessions, and we normally do it for around 4 sessions, 3 or 4 sessions, and most clients will start to see improvements in the animals by the 3rd session. If it's a more acute kind of condition like a sprain or a strain, you should be able to see, after that 1st session, you should be able to see some improvements between 24 and 48 hours.
Okay, awesome.
So, yeah, but it depends on the severity of arthritis, obviously, and it's really an individual response to therapy because not all dogs will respond to it the same way.
Okay. Are there any risks with acupuncture? We've spoken about risks with non-steroidal medication. Are there risks with acupuncture?
In general, there are very few risks associated with acupuncture. I remember when I did the course, the instructor was saying that, look, the worst damage you could do is to put a needle through a peripheral blood vessel, cause a little bit of bleeding or bruising, but generally that's it. And I think I've only done it once, like, putting it through a blood vessel. So in humans, I believe that some people will experience some numbness or tingling in certain areas, but it's normally transient and it resolves within 24 hours. I'm not sure whether, animals feel the same way, because they can't really tell us, can they? But yeah, but in general, yeah, there's very few contraindications. I think it might be contraindicated in pregnancy, or when there's a really generalized infection, or even in some forms of cancer. And that's why it's really important that you bring your animal in for a full vet check and correct diagnosis before you start to do any of this, adjunct therapies.
Yeah, awesome. Thank you. Okay, and the last question, Judy, thank you so much. She's tapped out. That's all good. Thanks, guys. We've run a bit over time, and I apologize, but we'll just wrap this up. The very last thing, and I guess this is a big question that sometimes we, like, a lot of the time with our seniors, we kind of go, oh, they're old. There's nothing more we can do. That's just it. They're getting old. They're winding down. Like, some people might feel their vets have said, hey, there's nothing more that can be done. Your dog's got liver disease, your cat's got kidney disease, they can't go into medication, they can't eat the special diets, they can't this, they can't that. Can they still try acupuncture?
Definitely. I mean, as we discussed before, I mean, there's no contraindications. It's a natural therapy, and it can reduce pain and inflammation associated with a lot of different conditions. And especially useful for senior dogs, with metabolic diseases or even cancer as well. And what we discussed before, if they can't take any medications, non-steroidals, because their kidneys or liver are shot, then they don't have, many options, do they? So, so even though traditional medicine is the first line of treatment, some issues associated with cancer or side effects of cancer treatment, such as tissue inflammation or nausea or decreased appetite, can be helped by using acupuncture. And, especially if it's just palliative therapy, and also dogs with diabetes, kidney disease, liver failure, pancreatitis, Cushing's or Addison's dogs as well, metabolic diseases, can experience a decrease in nausea and an increase in appetite as well after acupuncture sessions. So even if acupuncture can't cure a condition, generally it may make it more tolerable. So really important for palliative care patients.
Awesome. Fantastic.
Does that answer your question?
Yeah, it does. It does. And guys, if anybody else has any acupuncture questions that they want to ask Dr. Winnie, that would be amazing. What we might do is I might just sort of summarize things and end up. I think it's been super valuable. Thank you so much, Moira, Tina, Winnie, for sharing. I think the biggest message, the take-home message, is that there are so many options for our senior pets. So many. And the worst thing that we can do is to probably write them off as being old. And I know this is a fear that my mum has, and she's not that old. Like, my mum's not even 70 yet. But she has this fear that, oh, when I get old, are you guys gonna like write me off and like send me to an old age home or something? And I think we have to be careful that we don't do this with our pets. We have to be really careful that we don't, kind of write them off and go, oh, they're old, they're just slowing down. My own father had a little heart condition recently, and he had to go in and he had a little missing heartbeat. And he went in and he had it converted, and essentially his heart is now beating on all, firing on all cylinders again. And I asked him recently, I said, how are you doing? How are you feeling? And he said, I'm feeling so much better. He said, I'm 80 years old, and yes, there is that gap between my mum and my dad. That's how things were those days. And he said, I'm 80 years old and I'm slowing down. And I thought I was just slowing down. I thought I was just getting old and slowing down. And I thought there was nothing I can do. Meanwhile, I was suffering from heart disease. And as soon as I had my heart, the beat altered, and essentially, it was beating properly, and I was getting the blood everywhere and oxygen through my cells, I started to feel great, and I feel amazing again. And that's exactly the same thing we see with our old pets. We see this every single day in general practice, because the signs of old age, diseases that come in old age are generally slow and subtle, and they take time. They come on slowly. Your kidneys don't just fail overnight. The liver doesn't fail. The joints don't become arthritic overnight. All these things take time. They take, months and years to get to that point. And therefore, you watching that slowly over those several years, you just think that's a general slowing down. But where we see the biggest change is we see a dramatic change once we are able to stop that process, or make them feel better, or relieve their pain with pain relief, anti-inflammatories, acupuncture, change of diet, joint supplements, all of these things. And we do literally see animals get that bounce back in their step. We see them zooming around again. We see them walk in. There was a little story. I might just end with this. There's a lady who was a dog with really severe dental disease who came into our clinic, and the dog was about 16 years old. And it was a tough decision between, do I put my dog down, or do I go ahead with this dental treatment, which was going to be expensive because it's been years and years of dental disease that's been looming, and they were worried about doing anything about it several years ago. And as each year went on, they were more and more worried about the anesthetic risks, etc. Anyway, long story short, we went ahead with the dental procedure, and we had to remove, I think in total there were close to 18 teeth. I can't remember the exact number, and I know people freak out, but dogs have 42 teeth. And so, 18 might seem like a big number, but it's not even half. But ultimately, those were 18 rotten teeth that were causing this dog pain and suffering, and it was pus and smell, and it was just really gross. But the dog had the extractions. It was a very expensive procedure because that's what it was. It took a long time under anesthetic. There were 18 extractions. And then the little guy came back in 3 days later for his post-op check. And when he came in, his mum was in tears. And I was like, uh-oh, what's happened? Is everything okay? And she said, I've got a puppy again. And I was like, oh my goodness, what do you mean? And she's like, look at him. He's got so much energy. He's like, I can't believe how quickly he's recovered. He's just had 18 teeth removed. And look at him bouncing around, and he like waltzed into the room. His tail was wagging. And he's like, and so part of me is like tears of joy. I'm so happy that I've got a puppy again. But part of me is that these are tears of guilt as well. Because for all these years, I've not done anything about it. For all these years, I've watched my dog getting old and suffering, and I knew he had dental disease, and I knew his breath was smelly, and I saw him slowing down. But people said, there's nothing you can do. It's too risky. He's too old. Don't do it. Don't, and she's like, I wish I had spoken to you earlier. I wish I had just had him seen to and had the procedure done. And and it wasn't even about the money, although it was so costly, and it would have saved her money if she did it earlier. She would have saved a lot of money if she had dealt with the disease earlier than waited several years for some extractions. But even then, she was like, you know what? I wish I had done it before. It wasn't about the money. It was just for his sake and his well-being, his quality of life. And so ultimately, the take-home message, guys, would be, if there's anything, and I'm sure all of our panelists would agree, the take-home message is there are lots and lots of options for your senior. Old age is not a disease, okay? Diseases happen in old age, and more disease starts to happen in old age, but these are treatable conditions. We can either stop them and reverse them, or we can slow them down and stop our pets from aging so quickly. And ultimately, what that's gonna mean is that we get to enjoy more long, happy years with our pets, and we get to share all those joyous moments, which we've all experienced now during isolation, where we get to hang out with our pets and really bond with them, and that's what we love. Now, I did promise everyone that I would give them something, the people who've stayed to the end, and I do apologize that I've made you stay longer than you needed to. And so what we've got, I'm not going to talk about this at length, but ultimately there is something called a VIP plan, which we have just launched at the clinics. And VIP, the very important pet plan, is essentially a way that you can, it's all about convenience, and it's all about looking after your pets and giving them the best. And I'm not going to go into all the details here, but ultimately it's a way that you can pay a set fee per month and get all of your things delivered to you. Okay, so all your parasite control, your flea control, worming, etc., that gets delivered to you when it's due. Not just a reminder on your phone or an email saying you're due for this, but you physically get that product and you can just apply it or give it a tablet, etc. But also it includes the vaccine, it includes the heartworm, it includes all those things. And so you're not going to have these spikes of vet bills. It's just a nice steady, you can break up all your costs. But the biggest benefit in it is that we're offering unlimited telemedicine consultations. Okay, so just like this, you can connect on Zoom, you can connect over the phone, and we can see what's happening with your pet, especially for seniors. You don't have to move them to the clinic before you find out whether you needed to bring them in or not. Okay, so this is going to save you a lot of money. It's going to save you time. From the convenience of your home, you are able to just contact us, and we can have a free consultation with you to decipher whether you need to give them extra treatment or whether they need to come down to the vet or not. Okay, so this is something called a VIP plan. If you haven't heard about it, contact the clinic. They will tell you about it. I can include a link as well, and I'll put something up on Facebook afterwards about the VIP plan. Now, there is normally a $40 sign-up fee for the VIP plan, but anybody who's attended tonight, and we have a register of all the participants tonight, anybody who's attended tonight, who's keen to join, they will get that $40 fee wiped off. And I'm also going to give you guys a special senior book, which goes through all the details of how to care for your senior and what things to look out for. And so there's a total gift prize worth of $50. But anyone who does express any interest there, even if you just register your interest or you contact the clinic and you say you're interested in finding that out, we also have a free bag of senior dog food and senior cat food to give away, thanks to Tina from Royal Canin. I'm going to plug that just as a thank you to Royal Canin for sponsoring that. But ultimately, that's a free bag of cat or dog food to one of those lucky people who enter, and just to express your interest and see if that is a fit for your dog or cat. And the last thing I wanted to do is thank you all for your time, for being here. I hope you've got some benefit from being here tonight. I've really learned a lot from our panelists, and I really appreciate their time. So thank you very much. It's hard to do like virtual clapping, but maybe you could like wave or give a thumbs up or something like that, just to show you thanks. Thanks, guys. If anyone wants to throw anything in the chat box. Does anyone have any final questions before we wrap up? Oh, Winnie's gone technical. She's learned, geez, look at this. People are giving thumbs up like actual emojis. This is pretty cool. I've got to learn how to do that. Does anyone have any final questions before, before we close up there? No, I think that's it. Look, thank you so much, everyone. Really enjoyed it. And look, if you do have any further questions or something wasn't answered or you're a bit shy tonight or whatever, just reach out to the clinic. Contact us on Facebook. Thank you so much. Contact us on Facebook. Drop us an email, pick up the phone, do whatever. Like, we really genuinely want to support our seniors. We don't like to see animals suffer. We hate it, especially when we know there's something that can be done about it. There's sometimes you just can't do anything, and that's just part of life. But a lot of the things we see on a daily basis, we can do something about, and we really should. And the earlier we get in, the more we can help, the less expensive it is, and the longer, happier lives they will live. So thank you all for being here. I'm going to let you go. Take care. Bye. Hey guys, how'd you go?
Good. Thanks for that. Thanks for inviting me along.
Sorry, it was a bit longer than I thought. I didn't get my timings very well. Apologize.
I think it was all informative, so I don't think there was anybody sitting there complaining.
No, I think people benefited. We didn't get onslaughs with questions. Narelle's still there. I don't know if she can hear us. Narelle's you guys both know Narelle probably. She's
Mount Cravat.
nurses at Mount Gravatt. Yeah. So,
It was awesome, Ship. And
of
you
course.
guys, it was great.
Thanks, Narelle. Thanks for joining us.
Thanks,
Narelle's been
Narelle.
in isolation because she's special, so we're keeping her wrapped up at home.
I am special.
So we haven't seen Narelle. We only see her through these interactions here, and she's been handling our phone calls remotely, which is wonderful. So that's cool. Hey, thanks again, guys. I really, really appreciate it. Yeah, I don't know what else.
Thank you. Thank you very much. I'll see you
Thank
all.
you.
Go get.
Have a great week, everyone.
Take care.
Bye, guys.
Bye.
See ya.